Disability issues for refugees are largely unattended in much of the research, in society at large, and even among helping professionals. This project was a unique opportunity to explore disability awareness among refugee and immigrant communities and those who serve them. This project was sponsored by People Inc. By May 2024, there were over 43 million refugees worldwide. Since 1980, the United States has admitted more than 3.5 million refugees, and about 18,000 refugees have been resettled in Erie County over the last 2 decades. They represent a wide range of countries and languages. Based on available survey data, it's estimated that roughly 20% of resettled refugees have a disability. This aligns with the national disability prevalence. Even though they represent this significant percentage of the population, there is limited information about service provider awareness gaps regarding refugees with disabilities and their needs and challenges. In light of that gap, this project aimed to better understand the state of services in the Western New York region for refugees with disabilities and the experiences and perceptions regarding disability in the community. So how did we go about doing that? We held focus groups and individual interviews with disability service providers, refugee service providers, and community members from 4 different ethnic-based community groups. We started with service providers in January and conducted an additional group and interviews in June, giving us 4 focus groups and 2 individual interviews. In total, 29 individuals participated from a variety of personal and work experiences. Of those, 27 completed demographic forms. 2 participants identified as an individual with a disability, and 9 participants identified as an individual with a refugee and/or immigrant background. At the time of data collection, service providers worked at one of these 8 organizations: People Inc., Jewish Family Services, International Institute of Buffalo, Journey's End Refugee Services, St. Mary's School for the Deaf, Erie County, Western New York Independent Living Inc., and Buffalo Public Schools. There were 12 serving in a supervisor management role, 5 direct service providers, 1 administrative support, 4 in multiple roles, and 5 in a role other than those mentioned. Collectively, they had a combined 292.5 years of experience working in human services. After our first round of data collection with providers, we started reaching out to community contacts to see who would be willing and able to help us gather members of the community to talk about disability. From April to June, we were able to have 3 focus groups and 2 individual interviews with members of 4 different ethnic-based communities. In total, 26 individuals participated from 4 different ethnic-based communities: Congolese, Iraqi, Karen, and Sudanese. For data collection with community members, we asked, do you or a family member have a disability? 6 participants responded yes, 2 participants responded that they were not sure, and 13 said no. We also asked how long participants have been in the U.S. 6 participants had been in the U.S. for 5 years or less, 7 had been in the U.S. between 6 and 10 years, and 11 had been in the U.S. for 11 years or more. What did we learn? Providers and community members talked about barriers to services, including cultural perceptions of and responses to disability, gaps in cultural sensitivity and awareness from service providers, and system-level challenges that make access to services difficult. I'm going to highlight just a few things. Service providers talked about the reality of service provision for refugees with disabilities as a complicated landscape and described multiple levels of challenges impacting care. Within disability services specifically, barriers related to language, culture, and systems knowledge can make an already complex system even more complex. One participant expressed this by sharing, "Who qualifies? Who's responsible for what? It just was a really complicated system to navigate as somebody who was entering it for the first time." Diagnosis and eligibility challenges are complicated by the reality that refugees may not have been diagnosed or have documentation prior to entering the United States. Movement through the enrollment and connection process can be impacted by how responsive everyone involved is, funding, familiarity or not with documentation, and already existing wait lists. Examples of challenges during service provision include a lack of easy access to interpretation, notices and other materials not available in the appropriate language, and the use of jargon. On the resettlement service side, pre-arrival information about arriving refugees and diagnoses may not be accurate, or they may be undiagnosed. The reception and placement, or R&P period, is very limited and is focused on fulfilling specific grant requirements for that period, which may mean there are gaps between the initial R&P period and other services. Staff resources and knowledge about disability impact staff's ability to meet the needs of clients. Staff may not know what to look for related to indicators of a disability. When a disability is recognized or has already been diagnosed, staff may not have a clear roadmap for next steps. Service provision within the resettlement context is highly impacted by resource availability. A lack of resources can create disability, and providers noted multiple types of resources, which, when unavailable, make supporting clients difficult. This quote highlights one example. Our housing in Buffalo is so old that it's not really safe for people who have physical disabilities. So while housing should make people feel safe and supported, housing in the area is unaffordable, and older homes are not accessible. Many participants touched on the cultural differences, including language, that exist and the implications those have for service provision for refugees with disabilities. Participants noted that a lack of patience for those with limited English proficiency from medical staff and providers, as well as broader systems of care and human services, can leave individuals feeling unheard and disrespected. Understanding that cultural differences exist is important to providing services to refugees with disabilities and their families. Western perspectives on medicine, as well as beliefs about individualism and independence, may not align with the perspectives and beliefs of those coming from different countries and cultures. Knowing that potential misalignment exists can help providers communicate with and serve refugees with disabilities and their families. Participants specifically noted the importance of understanding parental voices and the tension between their values and the values often held by people and systems here in the United States. This quote highlights that. It reads, "If you want to promote self-advocacy as a value for this family member who might be 21 or 22, and they might not be looking for a lot in the way it goes, but mom and dad have been taking care of them for all of their lives. Our default position is to turn around and say, you should be using whatever skills you have available to control your life. Problem with that is that it's against so many cultural touchstones and so many communities." In addition to knowing that those differences exist, providers need to be willing to shift and adjust to meet the client where they are. Perceptions about disability and treatment held by members of the community include beliefs that disability is the result of a curse and a source of shame, pain, and/or embarrassment. These contribute to desires not to be diagnosed, and for self or family member to be, quote, normal, to be fixed. The first quote on this slide shows the impact of those perceptions. I had a mom tell me that she was considered a bad luck woman because she had one child who passed away young and another child with Down syndrome. Community members talked specifically about how the word or concept of disability itself can present a barrier. A lack of understanding, along with cultural and linguistic challenges with the translation of the word, can impact communities' willingness to talk about disability. Negative emotional responses to the word disability include feelings of discomfort, disappointment, and discouragement. Within communities, there's often a limited understanding of systems and processes. There are gaps in knowledge about what services are available, misunderstandings related to the role of service providers and the system, as well as a lack of understanding the disability service provision system and how to navigate it. One participant highlighted this well. They said, "Sometimes it's the lack of service, but sometimes it's a lack of understanding what services are available." The needs of the community include more resources and access to services, education about disability and available resources, and awareness and education about how to deal with the impact of war, trauma, and stress or worry. Educational and informational support for communities needs to be ongoing rather than just one-time events or handouts. The repetition of information is needed to help break stigmas held for generations, and walking with people through these complex systems will help embed the knowledge within the communities. One community member noted, "They cannot just come and say, 'Oh, here, this is the information.' No, it doesn't work for us. You have to take them from step 1 to step 10 if there's 10 steps. You have to make it all until they get it." Community organizations and networks serve as sources of information, support, and services. And because distrust is a significant barrier to service provision, and refugees may be hesitant to trust entities such as service agencies, schools, and the government, and individuals outside of their family, bilingual community members who understand the culture can help bridge cultural gaps as cultural brokers, addressing issues of distrust and helping people navigate the system. Another community member shared this, "Without that, a cultural broker, I don't think you would be successful, because it would just go back to square one. The reason is, 1, they trust their own community, speak the same language, and they know the culture in and out, and know the community." So what should we do now? What's next? We took what we learned and heard from participants and developed some recommendations. One recommendation is to develop and implement resources and trainings for service providers. Trainings and information that address cultural humility, language access and interpretation services, immigration law and systems, resettlement processes and available programs, and disability, including information on eligibility and services. For disability service providers, we suggest one-page information sheets with contact information for resettlement agencies and immigration attorneys, training for all direct service provider agency staff on refugee resettlement, asylum processes, and other migrant processes, cultural mindfulness and sensitivity, and language and communication tips, such as reduction of jargon, use of a language line. For refugee service providers, we suggest a one-page information sheet with contact information for the various disability service agencies, training for all refugee service provider agency staff on disability services and resources, eligibility and enrollment processes, and identifying markers of disability with appropriate referral information. Related to community engagement, we recommend education or training to explain systems, processes, and the values that guide disability services. This could include, but not be limited to, information sheets with clear and concise explanations about the definition of disability, and information about available resources and services to support individuals with disabilities and their families. All resources should be translated in culturally and linguistically appropriate ways. We also recommend partnership with ethnic-based community organizations and cultural brokers to share information about disabilities, resources, and services. Additionally, there should be opportunities for community members to provide feedback on their values to help tailor services and care for a better fit. Participants' discussions of fragmented and disconnected service provision highlight the need to develop and maintain relationships between refugee and disability service organizations. So, at the organizational level, we recommend establishing or modifying an existing position within the organization to serve as the point of contact for refugee or immigrant serving agencies. We also recommend training that's integrated into onboarding processes. At the state and federal level, recommendations include increased attention to refugees with disabilities at all touch points in the resettlement process to ensure appropriate support and connection to services. This includes touchpoints at the Bureau of Population, Refugees, and Migration, the Office of Refugee Resettlement, the Department of Health and Human Services, and the Office of New Americans. We also recommend increased federal and state funding to support refugees with disabilities within and beyond the reception and placement period. Additional support could include the development and implementation of a specialized service checklist for individuals arriving with disabilities into the RNP framework, supported by additional funding and time to effectively complete it. Flexibility within refugee-related grants to allow for more person-centered approaches rather than restricted by need or time post-arrival, and programs to bridge the gap between refugee and disability service provision. We had a small sample of participants, so some opportunities to expand the research include learning from additional refugee and immigrant communities about their perceptions of disability and service provision, and getting diverse provider perspectives, those in disability and refugee immigrant services who were not interested in the intersection of these topics, and other professionals, for example, school staff, about their interactions with refugee and immigrant families regarding disabilities. Future directions for research could also include looking at different contexts to investigate how service gaps for refugees with disabilities are being addressed in other regions and states. You can use this QR code to review the full report along with references.